afternoon. I like to thank the organizers to give me this opportunity to present a full analysis of long-term survival with first-line Nivolumab and Ipilimumab in patients with advanced non-small cell lung cancer. Basically, this is original article published in Annals of Oncology. The combination therapy with Nivo and Ipilimumab demonstrated long-term durable survival benefit in several metastatic solid tumors, including NSCLC. The landmark 5 years analysis of phase 3 checkmate shows the 5-year OS rate was 24 versus 11% PDL1 more than equal to 1%, and also 19% in PDL1 less than 1% versus 7% in chemo. So Nivo and Ipo is approved as first-line treatment for adult with metastatic NSCLC and tumor expression PDL1 more than 1 equal to 1% in some countries, and this is approved as first line in less than regardless of PDL1 in Japan and other countries also. So here the study report the efficacy of first line Nivolumab plus Ipilimumab treatment in large pooled population patient with advanced NSCLC from checkmate 227 part 1, checkmate 817 cohort A, checkmate 568 part 1, and checkmate 012 arm P and Q. Study also evaluated efficacy in patients aged more than 75 years, the population of high clinical interest. The impact of the response status and depth of response on OS is also evaluated. So this is study design and data collection. If you see the regime in across the 4 trials, the Nivolumab dose is 3 mg per kg Q2 weeks, and Ipilimumab is given 1 mg per kg, except in checkmate where the Ipilimumab is given once in a 12 week, and in checkmate the Nivolumab given as a flat dose of 240. The trial key inclusion criteria are squamous, non-squamous, stage 4 recurrent NSCLC, where no prior systemic therapies are included, except in checkmate 012 where prior EGFR therapy when more than 2 weeks over is included. So baseline characteristic of patients in each individual studies, the age is across the trials, median age is 65 years. The people more than 75% of age is around from 10.1% to 19%. Most are the current smokers, and they are tumor histology commonly as non-squamous than squamous. So treatment exposure in pooled patient analysis, the median follow-up minimal is 29.1 months versus maximum in checkmate 012, and the treatment duration median is 4.2 months with maximum 6.1 months in checkmate 012. The efficacy of Nivolumab plus Ipilimumab, the median OS is 18.6 months with 3-year OS is 35%. If you see the OS in different individual studies, which is similar than the pooled analysis, around from 17.2 to maximum in checkmate 012, it is 22.2. If you see the 3-year OS, it's range from 34% to the 39%. If we see as per PDL1 expressions, less than 1%, its median OS around 15.4%, its range to more than 50%, it's 26 months. And then 3-year OS also again, it varies from 30 to 48%. So median OS as per histology, it is for non-squamous is 20%, with squamous is 15.1%, and 3-year OS is 30% and 38% for squamous and non-squamous. So median PFS, if you see median PFS is 5.4 months, with 3 years PFS is 17%. The objective response and median duration of response, the objective response is 16%, with around 36% patients has a complete and partial response. The patient, 38% patients at the 3 years are still responding. If you see PFS, and I think PFS with squamous is 5.6%, with non-squamous is 5.4%, with PDL expressions less than 1% is 4.2 versus equal to 1% is 6.6. 3-year PFS rate is around 16.9 in squamous versus 17.5% in non-squamous. And PDL1 expression level at 3 years with less than 1% is 11.8 versus 20.7% in more than 1% patients. So efficacy in patient aged more than 75 age, the median OS is 20.2 versus 20.2, and the 3 years OS is 34%. The PFS, median PFS is 6.9 months with 3-year PFS percentage is 15%. Objective response rate was 68 patients. The duration of response is 18.7 months, and 3-year duration of response is around 30%. So to understand the characteristics that may predict the response in responders, we consider earlier responder that less than more than 2 years and less than 2 years, and all responder versus the non-responder, they are consistent across all the groups. The impact of response on survival patients treated with Nivolumab and Ipilimumab. The landmark analysis done for OS at 6 months at 1,002 patients has included. Which is the responder, that is CR and PR, has the OS is not reached with stable disease and progressive disease is 13.4 versus 8.1. If you see 3 years OS in a responder, that is CR or PR, it is almost 66% versus 22 and 14% in stable and progressive disease. This is the data of the A group was the all pooled patients, the similar with the more than 1%, and this is the less than 1% PDL1. If you see the tumor burden reductions, the patient who has a tumor burden reduction more than 80%, that is 10% of population who has responded more than 80%, the median OS was not reached in both CR, that is more than 80% or even 50 to 80%. Hazard ratio is 0.6 and 0.2 compared to the stable disease. The similar data we see that hazard ratio is very significant in a PDL1 expression more than or equal to 1%, and similar we are saying even in the PDL1 expression less than 1%, the hazard ratio is still maintaining the significant, who has a best response reduction more than 80%. So safety analysis, this study shows no different safety signals as common with previous studies. The most common side effect is diarrhea. There is serious events occurring in 315 patients, discontinuation leading to 271 patients, and death is 1 patient. So the same, the immune-mediated adverse events more common is rash and hypothyroidism, with hyperthyroidism and rash. So conclusion, the durable long-term survival in Nivolumab plus Ipilimumab with more than 1/3 patients alive at 3 years, and median duration of response is almost 2 years. The similar to overall pooled population, OS benefit with Nivolumab plus Ipilimumab was also observed in patients more than 75 years of clinical interest. First line Nivolumab plus Ipilimumab well tolerated in large overall population as well as patients more than 75 years. Clinical benefit with Nivolumab plus Ipilimumab has been observed regardless of PDL1 expressions, and response status complete or partial at 6 months. Greater reductions tumor burden associated with higher magnitude and survival benefit. Thank you.